Do you deal with tightness in your legs? I know it's a very common problem amongst patients that I work with. I myself have some struggles with this, but sometimes the tightness is not due to the muscles. So today we're going to go through a couple of little tests to find out if you're having muscular tightness or what we call neural tension. Neural tension is when the nerve in the leg or the nerves in the leg are not gliding and moving quite as well as they should. We're going to test to see if it's muscle or neural tension. The first test we're going to do is just in a seated position. You're going to use a kicking in order to kind of find out if you're having neural tension or muscular tension. So what I want you to do first, if you kick that foot out and it feels tense, then I want you to point your toe downwards. Does that tension in that leg go away? And then I want you to pull the leg upwards. If you pull the leg upwards and you feel more tension, I want you to kind of note that, okay? If you point that foot down and the tension goes away, or you pull the foot up and the tension gets increased, you may have neural tension. We're going to do another little test here. I'm going to have you, I like to put my hands behind my back on this. If you can't do that, then don't worry about it. You can place your hands on your lap. But you're going to slump forward, okay? So you're just slumping forward like really bad posture. I'm having a bad day, tight posture, slumped. And then I want you to kick that leg forward. See if you have tension in that leg. And then I want you to sit up. Does the tension get worse or better when you sit up? Or a slouch? If you slouch and you feel that tension increased, and then when you sit up more, the tension kind of reduces some, you may be experiencing neural tension versus muscular tightness. We're going to do one more test, this time from a lying position. So join me here. You can do it on your bed. You can do it on your couch, wherever you're most comfortable. Some people enjoy working out on the floor with a yoga mat. You can do that if that's an easy option for you. But let's go ahead and lay down. Okay, we found ourselves on the couch or the bed. I'm using a mat here in the clinic. If any of you are in the Corpus Christi area, check out Scholl Physical Therapy, best place to be. But here from the mat, what I want you to do, you can use your arm to kind of grab hold of that leg, and I want you to try and straighten that leg until you feel some tension or tightness. I start to feel tension there. If I point my toe down and I feel the tension release a little bit, that could be neural tension. When I pull that toe upwards, if the tension increases, it could be neural tension. If you move that foot up and down and you feel the same tightness throughout, it could mean a muscular tightness, more of a tightness in the hamstrings, okay? These tests are not necessarily all-inclusive. You could have some muscular tightness and some neural tension. That wouldn't be impossible. So if you find that you're having muscular tightness, you can do a simple hamstring stretch. And if you do the hamstring stretch, you can either just use your arm like so and lift that up to make the stretch more intense. You straighten the other leg, straighten that up, and then straighten that way. Pull that leg up, try and straighten it out as much as you can. Really get a good stretch through that leg. Or something else you can use if you want to use a little bit of equipment that you have around the house, a belt, or if you want to buy one on Amazon, you can. Oh, it's raining straps. If you have a gait belt around the house, you can loop the gait belt and then loop that around your foot. And then again, straighten those legs out, pull that up, and till you feel a little bit of a stretch there. Hold that stretch a good 20 or 30 seconds. This is great if you're feeling like your tightness is more hamstring tightness or muscular tightness based on those tests we just did. The other strap that I used here, just a stretching strap, this has several loops in it. Same concept. You just loop that on your foot, pull that leg up. This other leg, if it's bent, it will make the stretch less intense. If you straighten that out, it makes that stretch more intense based on the positioning of the pelvis. If you find that you're stretching and you feel like you're having neural tightness, we're going to go through a couple of exercises to help with that. The first thing you're going to do, we're going to try neural flossing. So that is similar to the regular hamstring stretch. You're bringing that up, get it to a tight, where you feel that tightness and tension, and then you're just going to pump that foot up and down. I like to do up and down, circles. That gets the nerve sliding or gliding a little bit. Essentially, the nerve exits the back, comes down the leg and down around the ankle, and by pumping that foot up and down, it helps that nerve slide up and down in that leg. I like to imagine it's like a rubber band. It comes out of a rubber band coming out of my back, running down, wrapping around my ankle and into my foot. And if I was to move that foot up and down, that band is getting kind of pulled around that ankle bone. Probably more information than you wanted to know, but anyways, again, just pump that up and down. Something else you can do if you are able to lay on your belly is come right here. This helps me with neural tension more than anything. I find big changes in my neural tension when I do this. Lay on your belly, kind of arch that back if you can. If this is painful, just stop. Don't worry about doing it, but this is an option. I'll even come here. I'll put some pillows under my chest, kind of stretch out that way. It seems weird to stretch the back to improve the tension in the leg, but I promise you, if you've got neural tension, this could really help. If you can really stretch that out, or if you've got the arm strength to kind of stretch that out. If not, again, just put some pillows under there. Try and prop up on your elbows. Try and stretch. I'm going to go ahead. I do about 5 or 6 of these. Up and down, really stretch. Sometimes I'll come up top. I'll take a big breath, and then I'll let the breath out. When I let that breath out, I really try to stretch that back, let it kind of relax there. Again, if you've got spinal stenosis or some problems with your back, don't worry about this exercise, but I have found just a handful of those exercises, I have much better range of motion in my hip and leg because the neural tension releases. I just want to review with you, test that tension in the legs. If it's feeling more muscular, just do those traditional hamstring stretches. If you're doing those stretches that feel more neural in nature, in that when you manipulate or move that ankle around, the stretch or tension changes, then it could be more neural tension. So try those. And then based on what you're experiencing, try the stretches. But it would be a good idea to do a little bit of both, but emphasize on wherever you feel like the problem is. Definitely, it's not uncommon to have a little bit of tightness in both the muscles and in the nerves. So you want to do both probably, but like I said, focus on the one that seems to irritate more. And those things will help you improve the motion and tightness in your legs. That can even help with cramping. I found that if people have neural tension, it helps reduce the cramping that they experience in the leg. So if these exercises were helpful, please subscribe and check out some of our other videos in the links on the side here.